Hi guys, another what the F moment from Rishi Sunak. So along with stopping the boats and having inflation while growing the economy, try and get your head around that one, there is the pledge to cut waiting lists. So on Friday, the Prime Minister delivered a speech where he talked about recruiting thousands of doctors, nurses and other medical staff by making the training shorter in some cases and creating new places in further education. No mention of pay, of course, or using foreign workers to fill the gap in the meantime. But his response to a question from the Tory-friendly Telegraph is what got everyone talking. A shortage of dentists, you say? Rishi has a solution.
Telegraph.
Daniel Martin of Telegraph. Many people find it very hard to get an NHS dentist. Do you think that the more dentists should work in the NHS, and is there anything in the plan which would help achieve that?
The simple answer is yes and yes. One of the examples of reform is in dentistry, where we can have people who are not dentists but are in as the allied health professionals, where it's I think what they call therapists or dental, one of the roles where we expect them to do more dental work.
What the hell are you talking about? Is he talking, no, therapists? I don't know what he means by dental therapists. Maybe he's talking about dental hygienists. But dental hygienists are not dentists. Is this insane? Like, is he insane? Now, either he's lying or this is actually the policy. If he's lying, then that's serious. If this is the policy, that's even more serious. Which is it, Rishi Sunak? Are you lying or this is actually the policy? We're going to get people who are not qualified to do a job to do the job because we can't fill the roles necessary. We saw it before with the heavy goods vehicle drivers. There was a shortage, so what did they do? They changed the exam to make it easier. So, for example, reversing an articulated truck. Oh, God. You know, making the exams easier is not the solution. Getting people who are not qualified to do a job to do the job is not the solution. Once again, I don't know if he's lying or this is actually the policy, and I don't know which is worse. Perhaps getting people to do a job that they're not qualified is worse than a prime minister lying, because it's part and parcel of politics today. But, you know, you can't have somebody who's not qualified to do a job to do that job. Like, what's the point in studying to be a dentist if somebody who isn't qualified is able to do that job as well? This is insane. And what about the risks involved? Getting people who are not qualified. You know, there are certain risks involved in having somebody who's not qualified to drive a HGV. But there's a difference between that and somebody, you know, who's not qualified to work on someone's teeth, or, I don't know, applying it out to general medicine as well. I don't know if that's also the case, because they're talking about reducing the number of years it takes to qualify as a doctor, which would have two possible outcomes. Either you end up with a lot of doctors who aren't fully qualified, in the sense that they don't have all the knowledge, or you put a huge amount of stress and strain on student doctors who have to finish their exams in a shorter period of time. So they have to study more, or the same amount, but in less time. This is insane. All because you don't want to issue more visas, you don't want to return to something like freedom of movement. Where are the benefits here? You're saying we want to recruit staff, we want to hire staff, we want to retain staff, but there's no mention of pay, you know, which is one of the reasons why doctors, nurses and other medical staff are on strike at the moment, or they have planned future strike action, and working conditions. You know, what you should be doing, some of these policies are actually quite good, apart from the ones that I've mentioned. But some of the things that he's talked about are pretty good. It's about recruiting more nurses, more doctors, dentists, whatever. But in order to achieve these goals that you're talking about having in place by 2036 or 2031, you need to fill the gap at the moment. And how are you going to achieve that? It takes years to train up a doctor and nurse. And in the meanwhile, what are you going to do? Insane. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.